Welcome everybody. So we'll start just with like a little intro slide about me. So my name's Kelly Bender. I went to undergrad at Syracuse University and I got my Bachelor of Science there, majored in health and exercise science, minored in psychology, and then I went on to get my doctorate degree in physical therapy at Shore College in Bay Shore. I grew up in Rochester, so if you hear a little accent, it's because I am from up there originally. I'm currently the director of Metro Physical and Aquatic Therapy at the Patchogue location, which is actually located just right down the road inside Mr. D's Fitness. And then I'm also certified in LSVT BIG, which is a one-on-one treatment created for people who have Parkinson's disease to address their walking, balance, and other activities of daily living. And I'm soon going to hopefully also be certified in Pilates coming in January. Right. So getting into the topic, the aging body. So a lot of things happen in your body as you get older. Every system, pretty much everything is affected. So you got your cardiovascular system, so that's going to be your heart, your arteries, and your veins. Your musculoskeletal system, so that's your muscles, your bones, and your joints. Your digestive system, integumentary system, which is your skin. Your bowel and bladder function, you might notice will be changing. Cognitive function, so that's your thinking, your memory, and then also vision and hearing. So the ones that I have up in the bold, those are the ones that we're going to be focusing on today. All right, so starting with that cardiovascular system. So what's happening? So the most common change is stiffening of the blood vessels and the arteries. So when this happens, it causes your heart to work harder to pump blood through them. So because of this, the heart muscles have to change to adjust to the increased workload. So your heart rate at rest will stay about the same, but it won't increase during activities as much as it used to. And then this will increase the risk of high blood pressure, also known as hypertension, and then other cardiovascular problems as well. So what can you do to help promote heart health? So include physical activity in your daily routine. So this can be walking, swimming, any type of activity that you enjoy that gets you up and moving. And then regular moderate physical activity can help you maintain a healthy weight, and then that also helps lower your risk of heart disease. Another thing you can do is eat a healthy diet. So I'm sure you've heard this many times before: fruits, vegetables, whole grains, high fiber foods, and foods that are lean sources of protein. And then you want to limit your foods that are high in saturated fat and salts. Next one is to not smoke. So smoking contributes to the hardening of the arteries, and then this will also increase your blood pressure and can increase your chance for your heart rate to increase as well. You want to help manage your stress. Stress can definitely take a toll on your heart. You want to take steps to reduce stress, such as meditation, exercise, therapy, things like that. And then last, you want to get enough sleep. So the golden rule, 8 hours of sleep. You want to try to get that every night. So the next one, the musculoskeletal system, as I mentioned, which includes your bones, joints, and your muscles. So with age, your bones tend to shrink in size and density, something also known as osteoporosis. This then weakens them and makes them more susceptible to fracture. And then your muscles will generally lose strength, endurance, and flexibility with aging. And then these factors will affect your coordination, stability, and balance. So what can you do to help promote your bone, joint, and muscle health? You want to get adequate amounts of calcium. So calcium can come from dairy products. So that's your cheeses, yogurts, milks. But then also you can get it from broccoli, spinach, kale, salmon, tofu, and then you can always also be taking calcium supplements as well. You also want to be getting adequate amounts of vitamin D, which you can get from sunlight. So now that we're coming into the winter months, we're not getting as much sunlight. So you can also get it from food sources such as tuna, salmon, eggs, vitamin D fortified milk, and then again, you can also be taking vitamin D supplements. Again, you want to include physical activity in your daily routine, and it's important that these activities are weight bearing. So weight bearing would include exercises such as walking. So you're standing, you're putting loads through your legs, jogging, tennis, climbing stairs, things like that. And then you want to avoid substance abuse. So the last one we got is the cognitive system. So that was your memory and your thinking. So as you age, your brain undergoes changes that have effects on your memory and thinking skills. For example, healthy older adults might forget familiar names or words, and they might find it more difficult to multitask. So what can you do to help promote your cognitive health? Again, you see it again, include physical activity in your daily routine. So we're seeing this as a common trend throughout all of these things. So by doing this, it increases blood flow to your whole body, and that includes your brain. You want to eat the healthy diet, and then you want to stay mentally active. So that would be reading, playing word games, any types of puzzles you can do, take up a new hobby, play an instrument, all things like that will keep your brain mentally active. So it's kind of like exercise for your brain. Another way to think of it. Another thing that will help it is socialization. So socialization will help ward off depression and stress, which can contribute to memory loss. And then we have walking on here as well. All right, so the common thing, I think one of the common things through all those things was the physical activity. So physical activity is essential to healthy aging. As an older adult, regular physical activity is one of the most important things you can do for your health. It can prevent many of the health problems that come with aging, and it helps your muscles grow stronger so you can keep doing your day-to-day activities without becoming dependent on others. So this is a great picture that I got from the CDC. So it's showing both the immediate and then long-term health benefits for being physically active. So some immediate things that it helps with is improving your sleep, reduces your feelings of anxiety, and helps reduce blood pressure. And then some of the more long-term effects that it can have for adults is the brain health, which we already mentioned, heart health already mentioned, can help prevent cancer, helps you maintain a healthy weight, helps that bone strength, and then also balance and coordination to reduce your risk of falling. So for the CDC guidelines, it is recommended for adults aged between 18 and 64 to get at least 150 minutes a week of moderate intensity activity. So brisk walking is actually included as a moderate intensity activity. So you can break it up a little bit, 30 minutes a day, 5 days a week of doing this. And you want to get at least 2 days a week of activities that strengthen the muscles. So you want to aim for the recommended activity level, but you also just be as active as you possibly can. These are just guidelines. And then for adults that are age 65 and older, the CDC guidelines are actually the same. The only thing that's added is activities to improve balance. So an activity of that would be like the picture I have on the screen of standing on one foot. So here are some examples of other exercises you can do to help you get up and move to that moderate intensity activity level. So the brisk walking, which was I already said. So you can do this with a partner. Get a walking buddy, get out there, have fun while you walk, listen to an audiobook, things like that. And the 30 minutes will go by super fast. You could also walk on an incline. So incline walking is going to actually help increase the heart rate. You'll notice it's harder to walk up a hill than it is on a flat road or even going down a hill. You can ride a bike. So this can be a bike on the road or a little bit more safe, might be like a stationary bike. You can also get on. Swimming is great just for your overall health, and again can get you into that moderate intensity range. You got jumping jacks, jogging, and then even climbing stairs. So the next, I got some examples of some strengthening activities. So I just wanted to make a note, all these activities can be done either standing or sitting. So I've got a chair here, so do some demos. So we have squats. So squats can even be mini squats, or even essentially a sit to stand, which is what this woman's doing here. So if you need to, you can have a chair that has arms on it if you need your arms to help stand up and sit down. Great strengthening activity for your legs. The next one we got is marching. So marching again, sitting, just lifting those legs up, or you can do it standing, even holding on to a table, marching, getting those legs up. Next, we got heel raises. So that's going up on your tiptoes and down. And then you could also sit down and do those heel raises. Ankle pumps, this one you might only be able to do sitting down. So that's just pumping the ankle back and forth, up and down. I also really like this one because it helps with circulation going all throughout the leg. So if you ever notice your ankles or your feet look swollen, pop the leg up, do some ankle pumps, get the blood circulating through that leg. It should help with that swelling a little bit. Next, we got bicep curls. So that's what this image is doing. So if you don't have weights at home, that's okay. You can use water bottles, you can use soup cans, and that one you can do sitting down. And then very easily, you could also do that one standing up. LAQ, so that stands for long arc quads. So that's what this lady's doing in that corner. So that's just kicking your leg out straight. And the sit to stands I also already demonstrated at the beginning. So for these, you want to aim to do them about 20 reps. If that's too much, you can do 10. If you feel like you can still do more after that, you can go up to 30. You kind of have to just listen to your body on that and how you're feeling after you finish it. So I have some examples next of some balance exercises. So you saw the one before of standing on one foot. So I also want to mention for all the balance exercises, if you're doing these at home and you're alone, I would really recommend you either standing in front of a chair or in front of a table, a couch, something that you can hold on to while you do it, because it's still working your balance even if you're holding on. So the image at the beginning is sitting on one foot. The next is Romberg stance. So that is feet together. So you can stand with your feet together, which is narrowing your base of support. So it's going to challenge your balance a little bit. The next would be is tandem stance. So that's one foot right in front of the other. Again, it's narrowing your base of support. It's going to really challenge your balance. And you can also do a modified tandem stance. So you can see it in a picture. So tandem, they're stacked right on top of each other like a straight line. Semi-tandem, the front one's a little bit off to the side. For these, you can do, I would do them based on seconds. So try to hold it for 5 seconds. See if you can hold it for 10 seconds. You can work it like that and see how you improve with your balance. So stretching exercises are also really important. You want to make sure you're stretching your arms, your legs, your whole spine. So that would be your neck, your trunk, your lower back. And then chair yoga is actually really great for this as well, for stretching that body. So in the image, there's 5 chair yoga poses. So the first one, she's just sitting and twisting. You could twist, hold for 10, 20 seconds. Make sure you're doing the other side, 10, 20 seconds. The next one she's doing is going to be for her neck. So she's pulling the neck over to the side, giving yourself a nice good stretch. The next one, she's reaching over. So you'll feel this all on the side of your trunk. Just getting a good stretch. She's also reaching straight up, opening the lungs, opening the rib cage, help with your breathing, get a nice good stretch that way. The next one's a little bit more complicated.
It's a good one.
It's called Eagle.
So good.
It does feel good. It'll stretch all the muscles on the back of your shoulders and your shoulder blade area. And then the last one, she's kind of, yep, you got it.
There you go.
It is. Yeah.
The opposite
The
side.
opposite side, yeah.
This one's okay, but this one I
Yeah.
had a little bit of an issue. Okay.
And then the last one, she's just puffing her chest out, getting a good stretch again, opening the front of your chest. The image that I have of the lady sitting in the leg straight, that's a good stretch for your hamstring. So that's the muscle that's on the back of your thigh. So you'll have your leg out straight in front of you. You'll have the toe on the ground pointed up. And if you lean forward at your hips, you're going to start to feel a good stretch in the back of that thigh. You might even feel it down towards your, and that's just telling you that your legs are pretty tight. So this is a great one to do. You can do this a few times a day. All stretches, in my opinion, I think you can do a few times a day. A lot of people are sitting in the same position, have the same posture for hours on end. So doing a good stretch, it always feels good.
Indeed.
Right?
Always tight.
All right. So that was just a little intro or a little introduction to some of the exercises and stretches that you can do on your own. If you feel like you really have an ache and pain that's like not going away, or you want some more guidance in terms of a more individualized plan for your aches and pains, I would definitely recommend getting an appointment with Metro Physical Therapy. So at Metro, when you first come, you'll get an evaluation, and then from that evaluation, where we go over, what you're feeling, you'll get some one-on-one treatment. So depending on what you need, that could be some manual treatment. So that would be stretching, massage, or it also could be one-on-one treatment in terms of helping you with balance tasks, or you're walking, which is what gait is. And we'll make you a customized exercise program, and then also a program for you to do while you're at home, if you're not coming to therapy. And then another thing that Metro offers that's really, really good is the aquatic therapy.
Where is the aquatic therapy? Because I went to Metro because I needed to go someplace with a pool.
With the pool, yep.
And I went there and there was no pool.
Yes. So not every single one of our locations has the aquatic therapy, but closest to here would be our southern location, which is maybe 10, 15 minutes away.
Just take 83 straight up, or take Nichols, or right off Nichols. When you go north on Nichols, make the right onto Mill Country Road. It'll be on your right-hand side, past Taco Bell, or if you take it 83, go all the way up 83 to hit 25A.
Yeah, that's too far for me. But I went to the one in Patchogue because that's where I was told to go. And then when I got there, thank God I went on a tour beforehand because I wanted to see the pool because of another reason. And there was no pool, and they told me you can go to the YMCA. I'm like, well, why are you advertising that you have aquatic?
Yeah, so we used to rent a lane from the YMCA. However, what was happening, so the YMCA is not considered a therapeutic pool. So the temperatures are usually around like 80 in the 80s degrees. So some of our patients who were going there would say like some like neurologic conditions, it was causing them to have spasticity in their muscles. So it wasn't really being super beneficial for them. And when we opened our Selland location just a few years ago, that has a therapeutic pool right inside. So when I say therapeutic pool, it's between the temperatures of 94 and 97 degrees.
94 every day. Salt
So
water.
so that muscles and everything like that. So once they open there, we found it more beneficial for our patients to be going to that pool instead of keeping the contact with the YMCA here in Patchogue. And then we also offer acupuncture and occupational therapy. So as you said, I kind of mentioned there is one located in Patchogue. It's right down the road on Main Street, and we're inside Mr. D's. We actually had a renovation there, so now we're doubling up. Unfortunately, as you mentioned, we don't have a pool there. We have 14 outpatient locations.
We have 2 in Florida.
We
We have one in
two.
Tampa and one in Lake Worth. We also have assisted living across Long Island. So our closest assisted living, I believe, is in Spitttown, called Whisper Woods. Beautiful facility. We also have location in Kew Gardens. So we're as far as the city.
Yeah, we're kind of all over.
We're all over in Queens, in the Atrias. You can find us just about anywhere. And we open up a beautiful clinic in Bethpage for women's health.
Oh yes, we also offer the pelvic floor therapy as well.
Which is a remarkable program for both women's and men's health.
All right, so now time for questions. So you guys have any questions? I know we have some in the chat, I believe, as well. Yeah.
I have a question.
Yes, please ask.
Yes, my orthopedic, can I speak now, or?
Yes, you can.
My orthopedic doctor told me that I have no cartilage left in my knees and suggested that I would start with a cortisone shot, which only lasted for 3 weeks. And I had it in both knees. And then after a month, I had those 3 gel shot injections, 3 weeks in a row. They really didn't help. When I did ask him about physical therapy, he says there's nothing that you could do because you don't have any cartilage. And also you might do things that might be more harmful than helpful. What are your thoughts?
So it sounds like did he want to do surgery for like a knee replacement?
No, I don't want to, well,
Okay.
that would be the last thing that he mentioned, but I'm past 80 and I don't want to have surgery.
Gotcha. So yeah, so in therapy, we can't rebuild that cartilage in the knee, but what we could do is just help strengthen all the muscles and structures around the knee, which could then in turn help with your function, hopefully help decrease your pain a little bit. So that's what
I
we
get stiff when I sit
Say
and
that
I
one more-
have to get up. I usually use my hands. It's hard for me to get up from a chair many times.
Yeah, so that has to probably do, you know, with your strength. So the strength in your legs that is helping to push you up. And also you're gonna need some arm strength too, if you're using your arms. It sounds like you're kind of relying on your arms a bit to help get you up from surfaces. So obviously I'm a little biased, but I would say, you know, physical therapy definitely not gonna cause you more harm. And it could potentially, you know, just help with your strength and help with you function throughout the day.
Well, I mean, since the orthopedist feels this way, maybe I could get a script from my internist.
Yeah, so yeah, you can get a script from therapy from really any doctor. So your primary care doctor, your internist, your orthopedic. For the most part, if you're saying, you know, you're open to try it, I don't see why they would ever deny you that unless they like really strongly feel like it would cause you more harm than good. But for the most part, if you just ask that you want to give it a try, I feel like they should definitely give you that script.
Okay, thank you.
Yes. Do you want to do it for the next?
That's all I have.
Any other
Does anybody else
questions?
have any questions?
Anybody in the crowd have any questions for Dr. Bender?
Have you guys heard of this exercise called eccentrics?
Eccentric exercise, yeah, it's essentially, it means it's a certain motion of the body. So there's concentric, which is shortening, and then eccentric, which is lengthening. So do you have like a specific, like eccentric exercise?
Well,
It's
I
just a way to
came here
strengthen your
into the
muscles.
class and it's awesome, but there's no eccentrics classes on Long Island, they said. So it'd be awesome if like one of these physical therapy places offered it, because it's,
Just an eccentric class.
yeah,
But
anywhere on Long Island.
So we offer a few exercise classes actually.
It's a mix between physical therapy, Tai Chi, and yoga, ballet. And it's done by, maybe you're not knowing what I'm talking about.
Yeah, I think I'm thinking
Yeah.
something else.
And
Like
it's
pure
really, and then
Yeah.
I was flipping through the channels last night and I saw it was on public TV, so I taped it for this morning. I hope it will come through. But it's this lovely exercise that's not hard, like you can do it because it's all smooth. And I just wish there was a class to do it at.
We
There
do
isn't.
offer silver sneakers, which is actually amazing. Silver sneakers is a whole exercise class.
I'm not old enough yet for some sneakers.
We actually have videos on YouTube from Metro with our trainer, Mr.
Ian.
Ian.
And he is amazing.
I've taught the classes and they're so much fun.
They're very fun. He's great music, great
So you
energy.
have music, you have classes at your place for people
So
who are not.
We used to have silver sneakers in the clinics pre-COVID. Since COVID, we haven't brought those back yet, but like he said, we have been offering them through a YouTube channel
Yeah.
with Ian, who instructs them all. Yeah, but since COVID, we haven't brought back the silver sneakers.
You might want to look at the videos on YouTube about this eccentrics thing. It's by this woman who was an ex-ballerina.
No, eres por live, para el micrófono. Ele é bom.
This, she was left with what she could do
Very cool.
very well.
Yeah.
Very interesting.
Yeah, I'll definitely look it up. I haven't heard of it.
I actually took it through here. It was
Oh, really?
great. The lady came from all the way in the city.
Oh, cool.
Yeah.
Cool.
So the library is actually going to have another eccentrics class on March.
Oh,
24th.
eccentrics.
I
Yeah.
asked, we all in the class asked if we could do it again. You
Yeah.
guys should come. To
Yeah.
see what it is. It's awesome.
Yeah.
It could be a whole.
Sounds like a
new
great time.
Yeah,
But
it
it's
sounds like a
a whole
combination of
new
stuff.
revenue for you because
Mhm.
there's not on Long Island.
Yeah.
And it's gentle, you know?
Yeah, no, definitely. It's
I gotta write that down.
Vous voyez, tu as dormi un peu cet après-midi,
Yeah.
mais peut-être que tu dors ce soir.
We have another
March.
question. Do you have
I have a question.
help spinal stenosis and osteoarthritis?
okay. So arthritis was kind of what the question was before that was asking about. So having no cartilage in a joint, that's when doctors will often say, like, you probably heard them say, like, bone on bone. So that is what essentially osteoarthritis is. So that's the arthritis in the joints of the bones. So as I said, for that, and then spinal stenosis is kind of a fancy way to say arthritis in your spine. So for arthritis, we can't cure arthritis, but we can help build up those structures around those joints, help make them strong, make the range of motion what it should be, would be my recommendation for that.
Nancy, I see a hand. Did you have a question that hasn't been answered yet?
I have a question.
Yes.
Have you seen on television this advertising for so-called pain relief? I mean, it's all over the
Relief factor.
channels.
Relief
Oh,
factor.
relief factor, I'm sorry. And they claim that there is no medication in it. So what the hell does it, how does it work?
Is it a gel? Is it a cream?
Relief factor.
Relief factor?
Yes.
I have not seen that
Oh my
commercial.
God, it's everywhere.
I'm only on Netflix, so. We're gonna try to pull it up, to see what it is.
What did you say the date was for the eccentrics class?
March 24th.
24th.
Yes.
The reason I'm asking is because I take a lot of medication and I don't want to mess it all up with
Yeah,
something else.
This would be a question for your doctor. Because they'll know more so about what medications you're on, you know, what's okay to be taking with those medications. There's kind of a lot that would go into that. So that would be definitely a question for your doctor that prescribed you your medications.
All right, thank you.
Yes.
C'est qui qui est pas un docteur?
Je vais le voir.
Does anybody else have any other questions?
Do you by any chance by sheets on those exercises you were showing us?
I
Could you
don't,
share a
but if
couple of those
you, yeah,
slides?
if you want to give her my card,
Want
do
to
you
go
use
with-
email?
Mhm.
Yeah, so if you shoot me an email, I can give you
Okay,
like a PDF of the email.
okay, wonderful, thank you very much.
Hi, Juliana, how are you?
Oh, you remember
Of
me?
course I remember you.
Oh,
Kathleen actually just told me today you're coming back, right?
yeah,
Yeah. I'll be happy to have you.
thank you.
How are you feeling?
Terrible,
Yeah? Oh, no.
I had a bad fall,
Oh, no.
yeah.
All right, well,
It's like I went to you for 7 months. Then I started going to the VA and they didn't offer massage therapy. I went for about 4 months. But it wasn't as good as it was with Metro because they didn't have hot packs. You know, they didn't do massage. And I did like more exercises in an hour than I did with them. It was more beneficial going to Metro, you know. And that's why I'm coming back.
yeah. One of my patients, yeah, so.
If no one else has any other questions, like Crystal mentioned in the chat, we'll be having another eccentrics class on March 24th, if that's interesting for you guys. We also have a storytelling class on Saturday, November 20th, and we're bringing bingo back. That's going to be, November 19th, that's tomorrow, and December 17th. So check out the newsletter. It looks like I've got one more question. Oh, chair yoga is also starting in January. Yeah,
What
chair,
is?
great.
chair yoga. So some of the yoga poses
Oh,
that
you
you saw
have
in
that
there,
here?
we'll have a chair yoga class starting in January at the library.
So will it be more than one night?
Crystal, will that be a regular thing? 3 Saturdays.
And then if anyone wants like contact information for myself or for Metro, I'm sure they could reach out to Crystal or
Yep, or to me,
Or
my
to-
name's Abby.
or to Abby,
If
and
you
then
guys
they
have
can-
any questions, reach out to the library and we will find that information for you. I think that's everything that you guys have.
yes.
All right.
Yeah.
Have a great night, everybody.
Well, good
And
night.
as I
Thanks for
said, if there are any
listening.
more questions, please
Excellent
reach
job, Kelly.
out.
Woo!